Hey, good afternoon, everyone. Thank you for tuning in. My name is Ruben Lebron, and I'm the political director with Alianza for Progress. Um, Alianza advances the power of Puerto Rican and Latino communities by moving forward progressive campaigns that progress our lives and improve the quality of everyone in our communities. Currently, Alianza is working on 3 different campaigns. We want to make sure that everybody is filling out the 2020 census. So please go to 2020census.gov to make sure that our communities are accurately counted. Every 10 years, we do this to make sure that the government does appropriate funding for our schools, for our hospitals, and many other resources that are very important for us. And the deadline has been extended due to the COVID-19 situation that we're going through right now. Another one of our campaigns is ensuring folks sign up to vote by mail. This is key because we want to make sure that our families are kept safe during this time. So please go to alianzavotes.org to request your vote by mail ballot. And we're also looking to change the name of a middle school in our community to Roberto Clemente Middle School. So look for more information regarding that at alianza.org/petitions. Also, if you're interested in helping out with any of these campaigns, or we're also conducting wellness checks to check into our most vulnerable and marginalized communities. If you want to make helpful calls with folks to see how they're doing during the pandemic, please message us, please email us, or please drop a comment on this Facebook Live. But without further ado, I'm going to introduce Dr. Frances Colon. Thank you for being here. She is the former Deputy Science and Technology Advisor to the Secretary of State, serving both Hillary Clinton and John Kerry at the U.S. State Department. She studied biology at the University of Puerto Rico and also earned her PhD in neuroscience. She's a 2020 Yale Public Voices on the Climate Crisis Fellow and coordinated climate change policy for President Obama's Energy and Climate Partnership of the Americas. Dr. Colon is also a respected member of the Alianza Board of Directors, and we're super grateful for her for being here today. Thank you, Dr. Colon.
Thank you, Ruben, and thank you to Alianza for hosting this webinar on such an important topic.
Great. Well, we're going to jump right into it with the questions. Please make sure as questions come up to write them in the comments. But Dr. Colon, can you start by giving us a brief overview of the climate crisis? What are the major risks and challenges in the U.S. and what about Puerto Rico?
Yeah, sure. So we've heard a lot about this climate crisis, especially in the last 2 years when there's been a large movement of youth with the climate strikes and more with Greta. The climate crisis speaks to the alarming rate at which climate is changing and the reduced amount of time that we have to react to this and do something at the systemic level. So what has happened is since the Industrial Revolution, we've been adding greenhouse gases into the atmosphere. So gases that are the result of burning fossil fuels. And that includes a number of gases, among them toxic pollution, but also CO2 and carbon emissions, which are more invisible to us as humans. But that act as heat trapping gases in the atmosphere. It acts like kind of like a blanket, and the heat gets trapped, and that causes our Earth to slowly warm steadily. That's been happening about a rate of 1.5% every year for the last 10 years. And so all of these climate negotiations that have happened, the one that President Trump pulled us out of, and the ones that we've signed before, all of these agreements, what they strive to do is keep the temperature increase holding at a certain level. We've put enough gases in the atmosphere that there's going to be a certain level of warming that we can't hold back, that we can't reverse. But what we are trying to do is to not let it go above a certain amount. And that amount is a 1.5 degree increase. Right now, if we do nothing to cut emissions into the atmosphere, we're on track to raise the temperature of the Earth in the next decades by about 3 degrees, which would be very catastrophic for our environment, for our species, for living things, for agriculture, for other things that we take for granted that live at a certain temperature and that are accustomed to living at a certain temperature. And so what science is telling us is that we have about 10 years left in order to make the really dramatic cuts in emissions that we need to hold the temperature at that 1.5 degree increase and not go beyond that. And how do we do that? We do that through cutting emissions at the systemic level. We'll talk about that later. But what I want to give you an idea is the things that we're already seeing in the US and in Puerto Rico are more extreme intensity hurricanes. And we know this happened with Hurricane Maria, and Puerto Rico saw an unprecedented level of damage. We're seeing longer heat waves or more numbers of hot days. What that means is if we do nothing to cut emissions in about 30 years, we're going to go from having about 20 days above 100 degrees in the summer or throughout the year here in the US and in Puerto Rico and Orlando, Miami, everywhere, to about 100 days a year where we would have temperatures above 100 degrees. Imagine what that does to populations that are vulnerable, what that does to agriculture, what that does just across the board. So imagine in Puerto Rico, we have rising sea level, we have extreme heat waves, we have more intense hurricanes. This has impacts on our aquifers, it has impacts on our agriculture. And here in the US, the same deal. Across the board, the same types of impacts. And we've already seen some of this through hurricanes and some of the forest fires in the last few years in California, and in many more ways in which climate change is manifesting, and it's becoming critical for us to take action.
Yeah, so one of the main things that I heard is that, we're seeing a lot of these impacts already, but we still have time to stop some of those most dire impacts within the next 10 years and preventing that 1.5 increase in overall temperature. And, it's Earth Month right now, and we just celebrated the 50th anniversary of Earth Day last week. What's the history behind, each Earth Month, and how much progress have we really made?
Sure. So back in the 70s, late 60s and 70s, our environment, if you can believe it, was a lot more polluted. There was a lot of smog in the air. Rivers, the waters in the United States were very polluted. There were even rivers that were catching fire from toxic waste in the rivers. And people were really concerned across the board. And there was a senator, his name was Gaylord Nelson. He decided that it was time to take action at the policy level. And he teamed up with a member on the other side of the aisle to create a movement of teachings and protest and people getting together to talk about what could be done about the environment. This is what resulted in Earth Day. The first Earth Day happened 50 years ago. We're celebrating the 50th anniversary. April 22nd, every year we celebrate this day. And it's a moment to pause and create awareness of where we are in terms of our relationship with the natural environment. What I can say is that same year, 1970, we created the EPA, the Environmental Protection Agency. And as a result of that, we got for the first time the Clean Air Act and the Clean Water Act. So we did make a lot of progress. And our air today and our water, the way we regulate what goes into it, how we control the quality of it, all was a result of that movement, that first movement of people getting together across the country, all putting in a little bit to create these regulations and these watchdog organizations that have kept an eye on our environment ever since. So we've made a lot of progress in terms of toxic pollution and making things cleaner. What we have made no progress on has been the emissions of greenhouse gases, or those gases like carbon dioxide that we have continued to put out into the atmosphere since the Industrial Revolution at a steady pace. And we have really just not gotten off the fossil fuels. A small percentage of our energy in the United States can be attributed to renewables, but the majority of our energy and the use of energy comes still from fossil fuels. And the changes that we need now, what this moment in history guides us to, is we've made a lot of progress, but there's a lot more to do. And COVID has shown us some of those things, and we should talk about that too.
Yeah, and obviously the climate crisis is not the only crisis that we're dealing with right now. We're obviously in the middle of a pandemic. So could you talk a little about COVID-19? from a global perspective, where has it hit the hardest? Which countries are most affected? And are any parts safe?
Yeah. So COVID-19 is the way we've named the disease. That's a result of the virus, this coronavirus too, that we're experiencing transmitted across the world. Um, What we've seen is that there's countries that have been harder hit just by the movement of people. First started in China, and then we've seen movement of people from there. And we've seen countries really hard hit, like Italy, Spain. The United States right now is the country with the most cases in the entire world. So right now we are the hardest hit right here at home. And we're still going through it. There's a lot we're learning about the virus and about the disease that it causes and how it hits different people in different ways, from young to old. We believed in the beginning it was primarily impacting most severely the elderly population, but now we know that it impacts much more than that. And one of the interesting things of going through this is that we've had to implement isolation policies across the world in many cities and communities and countries. What that has done is that one of the side effects has been that people move around less. And when people move around less, they use less transportation modes, such as cars and airplanes. People are not traveling. And this has caused the effect of a decrease in air pollution of more toxic gases like nitrogen oxide and other things. So space agencies like NASA have been documenting clearer skies across the world, in China, Italy, even in the US, in Los Angeles and New York. But what we haven't seen as big a decrease in has been in greenhouse gas emissions. So while toxic pollutants like nitrogen oxide has decreased by 50% in some cities, the decrease in carbon dioxide has only been about 5%, and some experts are now saying by the end of the year we'll have documented maybe an 8% decrease. And the reason is while movement of people has been slowed down tremendously, there is still a lot of electricity being generated. People are at home, they're maybe not at work and maybe they're not traveling, but they're at home. So we're using energy. And we're certainly still manufacturing goods that people are using in their homes. And we're certainly still shipping those goods. And all of those things cumulatively mean that we're still using energy, a lot of fossil fuels, and still generating a lot of emissions.
Oh, that's really interesting. I think all of us have seen pictures on social media about, China or New York or LA with clearer skies. But it's very interesting how the earth and nature can recover so fast when you just let it. But at the same time, like you said, many of those carbon emissions are still not recovering as fast. So how has the management of the COVID-19 crisis and the way humans are reacting to it and adjusting to the pandemic relate to the climate crisis?
Yeah, it's been interesting, right? Because what we've seen is that science came out and told us this is what's causing this disease and the loss in life. This is what's happening in terms of community transmission. This is how it works. And this is what we can do to slow this thing down so that our hospitals are better able to cope, so that we can save more lives. This is how we flatten the curve, right? Everybody heard about the curve. And so we were all told the less we interact and we keep distance between us and we remain in our family units and we don't go to things that we usually would do, go to school, go to work, the more we'll be able to flatten that curve and reduce transmission rates. And people have really taken that advice and gone home and isolated in their family units. And our lives have changed tremendously in the past few months as a result. But what we've seen is the result is that we are flattening the curve in many cities and places where we were seeing a spike in cases and transmission. And I think one of the most interesting things about this is that people are discussing science and the advice of scientific experts in their homes and taking that advice and incorporating it into their decision making. We're deciding about our own personal lives, family units, behaviors as a result of what the experts are telling us. And I think there's an interesting parallel there with climate change. We've known the science behind climate change for a long time, and we've made decisions as a result. I think what's interesting to note is that the impact of the virus is more immediate and in our face and happening right as we are living our daily lives, right? And we're seeing it play out. And we know that not heeding the scientific advice has an effect on our lives and the well-being of our families and our communities. So we're self-isolating, not just so we can not contract the virus, but also so that we can stop spread. So it's kind of sort of individual benefit, but the well-being of the community and of this phrase of all of us are in this together, right? And there's parallels there to the climate crisis where our hope as scientists, our hope as people that work this issue is that people start listening more to what we know are the predicted impacts of climate change. Many of those predicted impacts we are starting to see. Here in Miami, there's recurrent flooding, there's heat waves, and many things that we're already seeing that are telling us it's time to start acting and to not sit on the sidelines anymore. And so my hope is that this is sort of a wake-up call for all of us to say, in the same way we were willing to act to protect our families and protect our communities, that we act the same way as we have to make big decisions about climate change and our behaviors to alter the impact of climate change in the future.
No, I think you brought up a key point, is that science is increasingly being the central discussion in our homes. You've heard Dr. Fauci and many other experts become sort of rock stars in a way. So what are your thoughts on that?
Yeah, it's for me as a scientist that I've been working on this idea of how do you make science easier for everybody to understand, more translatable, more just mainstream, because science isn't this thing that lives in a laboratory or with a crazy person with a lab coat. Science is something that informs us so that we can make better decisions, right? It gives us answers. It gives us cures. It gives us solutions. It gives us paths forward. And to me, it's obviously I've lived my life as a scientist, and it's a moment where being able to talk about this here with you on TV, on the radio, where we talk about the virus replicates, the virus transmission, what happens if we do, everybody's talking about models and statistics, and it's kind of a dream for a person like me. But I think it's also a moment for us as scientists to understand that we should take this opportunity to speak broadly about this. Science serves society. Science belongs to everybody. I received an education, like I said, at the University of Puerto Rico, and then I went and got my PhD in Boston. And I had that chance because people paid their taxes and we funded scientific research, and people like me got a chance to get an education. And now it's time for people like me to pay that back to my community in Puerto Rico, to my community in Florida, to my community in the United States, by making science accessible and making it serve everybody and making it so that we can all reap the benefits of all the people that have invested so many years in understanding how viruses work, understanding the public health considerations and how we can stop this, protect people, and get our economy back open.
So not only science is at the forefront of our daily conversations, but also its intersection with politics. As we've seen, we've had many politicians and experts, spread misinformation or conflicting information about best practices during this crisis and whatnot. So, in a time of crisis, who can we trust and who should we listen to right now?
Well, I think that we are more perceptive than politicians sometimes give us credit for. And I think people know very well when an expert is giving them concrete advice based on evidence and science, and when somebody is not doing that. And it's been interesting to see how this all developed from the beginning, where were saying that we had this contained, it was airtight, we were going to be fine. And what you saw was that the politicians were saying one thing, and the scientific experts leading the National Institutes of Health and the CDC were saying something completely different, and how that has played out. I think we have very good instincts, and we understand where good information comes from. But I think that as we move forward, what we have to consider is that all of our decisions every day have an impact on who leads us and who makes decisions for us. And what I mean by that is we have a chance to decide how we confront the next pandemic or the next crisis or the climate change crisis going forward. And how we do that depends on who we choose to make those decisions for us, right? And living in a democracy, we have the chance to register to vote and to choose the leaders that we want making those decisions. And as a reminder, everybody that's in elected office works for us. And we decide who those persons are at the ballot box by the power of our voice and vote. And if we are dissatisfied with the management of a certain issue, whether that issue is as local as your potholes in your street or as big and abstract as what some people view the climate crisis. What do I do? What can I do? Where there's always something we can do. You can do things in your own individual family units and communities. And those things can go from anywhere from, we've decided to go the route of an electric vehicle and reduce emissions that way. But there's bigger systemic changes that we need. And those bigger systemic changes happen when we alter the composition of who is making decisions for the community. And so in my view, when we are at the ballot box, we are making decisions for the future of our children, for the future of our families, for the future of our communities, for the future of Puerto Rico, for the future of the diaspora. Across the board, that is what we are voting for. And when we don't vote, we're letting others decide for us. And how we vote really determines how the outcome of those 10 years that we have left to do something about the climate crisis, or how we face the next pandemic, what the outcomes of that will be.
No, Dr. Colon, I remember after Hurricane Maria in Puerto Rico, my hope was that, we would learn and, create better systems so that for the next crisis, we would be ready. And part of my hope, again, is both in Puerto Rico and the United States, that after this, we learn and we're better prepared for future disasters, pandemics, or other situations. So as a nation, are we disaster ready? And what do you think needs to change to get us there?
I have to say, we've clearly shown that as a nation, the United States was not ready for this pandemic. Not only did we not have the leadership in place to make quick decisions as soon as we had the information, which we had very early on, as early as late January. But we didn't have the systems in place to help us through it once we understood and once we began to act. The whole system that we have built, our public health infrastructure, health insurance, was not the type of system that allowed us to deal well with this. From testing, which went horribly wrong at the beginning, to now how we care for people, hospitals' capacity to deal with a surge. All of these things were definitely not ready. We were not ready for. And we've had a lot of overwhelming of that infrastructure and a lot of loss of life as a result. Our system was just not set up for this. This, despite many planning exercises and strategizing that was done at HHS, Health and Human Services Agency, and at the Centers for Disease Control throughout the years, planning for a potential future pandemic, which has always been the case. And we've had smaller experiences with this, right? More short-term experiences, like with MERS, SARS, avian flu. We've had these epidemics around the world and these outbreaks, and we've seen them play out. And in the places where they've played out, nations have made changes and strategized, and we've learned from those. But there's a lot of learning here to be done. We certainly were not ready, and I think we have to really make tough decisions now about how we will prepare in the future. I think in the same way, our experience in Puerto Rico with Hurricane Maria showed that we weren't ready for that type of natural disaster that affected the island and destroyed so much, from heavy loss of life to economic losses and measurable economic losses. Today, I can tell you that our electrical grid in Puerto Rico isn't ready for a similar storm. Our economy is still in recovery. The federal assistance is still not flowing and still being held up. And so in many ways, our governance has shown from the island to here in the mainland that we're definitely not ready.
So hopefully now and in the future, our leaders will take these crises and preparing for them more seriously, but also as voters, we take that responsibility to, like you said, make sure that we're putting leaders who will be prepared and who will put the ideas and teams and resources in place to make sure that we are disaster ready as a nation. Do you think that after experiencing this COVID-19 crisis, people will take the climate crisis more seriously?
I think things are going to change. I can tell you that experts expect the economy to rebound, and for us to go back to business as usual emissions, which is not a good sign, given the very little that we've been able to actually reduce greenhouse gas emissions in this period. So I think that in terms of how our economies are run and the decisions we've made on how to power those economies, we have a long way to go in terms of making those systemic changes that would really transform how we go greener and how we really do this. We're talking about our drastic cuts, about 8% reductions in emissions every year and more every year after that, to get to where we want to go. And that's, imagine if we've only been able right now to reduce so little of it, what that means in terms of what we have to do. That said, I think that we can't underestimate the impact of having to deal with this crisis. A lot of the flaws, and I would call it kind of the cracks in our system, in terms of our social contract, have been exposed. I think that we know now, for example, here in Florida, we know that in terms of our unemployment system, we're really hurting. We're not set up to help people. Our public health infrastructure, our health insurance, is really not set up to take care of a great number of people. The way we've been distributing tests out, we're really not set up to take care of the scaling up that would mean that we're now able to open up the economy in a safe way. And so all of these things, that I think because of the pace at which we live every day, all of those flaws were there, but they weren't as evident. It wasn't as evident that our social safety net wasn't as strong because we didn't have that many people needing it. It wasn't as evident that so many people were one paycheck away from going hungry because everybody was living paycheck to paycheck, and we were living in this very precarious balance. Same thing for how many uninsured we have. And I could go on. All of these things have been exposed, and they are the conversations that people are having in their homes. It is the conversation people are having when we have endless lines of hours to pick up food at a farm share. It is the conversations that people are having when they filed for unemployment 2 months ago and still have no response, or getting rejected from the employment system in their state that everybody has paid into in taxes. And so what I think we'll see is maybe our economies will take longer for us to make the systemic changes that would make drastic cuts. But I can tell you that you can't unsee what we have seen in the last few months of this pandemic crisis here in the United States, the most powerful nation on earth, and we are going hungry, and we can't test our people, and we can't help people get through a period of unemployment. And that is what I think will make the difference in the future in terms of the conversations we have to have about the climate crisis. Climate is something that when climate change impacts happen, it will exacerbate all of these things that I just talked about, that the pandemic sort of uncovered and put in front of us on a silver platter. Here it is. Here are all the flaws in your system that we were just too busy to notice. And what you're going to have is a set of conditions that are going to happen, whether it's natural disasters or droughts or erosion of our coastal communities. All of these things where people are already under stress are going to become even worse. And so this is an opportunity for us to say, okay, we've seen where we need to act. We've seen where we need to demand a stronger social contract, and we know what we need to do so that climate change impacts don't have an even stronger effect on our frontline communities that are already struggling.
Yeah, I think this crisis has shattered many of those expectations and assumptions we had as a society, and also shown the lack of safety and social nets that we have to protect not only the most vulnerable, but everyone when a crisis like this happens. So what can we do? We have 10 years. What can we do right now in Florida as a community, but also throughout the nation to stop the climate crisis and make sure that its effects are not as adverse as they could be?
Yeah. Well, I think we need to demand change in our public policies around emissions. And I think that's going to come potentially from demanding that we put a price on carbon. It's going to come from holding the biggest polluters accountable for the damage they've caused and for the damage that they fully intend to cause in the future with impunity. And to do that, we're going to need strong leaders in Congress, in our local communities, across the board, that do not let these people get away with this, right? And so in terms of what we can do, because we need such drastic cuts that we are going to have to make drastic changes in our policies. And that is going to come from big decisions that we're going to have to make at the national level with the right leadership in place to put in place those measures, whether it's holding fossil fuel accountable, whether it's putting a price on carbon, whether it's putting back the regulations that got rolled back during this administration for fuel efficiency in vehicles and more. I mean, it's really going to have to be a concerted effort for big policy change. That doesn't mean that all of us at the individual level cannot have a change in our behavior, in the way we live our lives, because the sum total of that does make a difference, right? And so as individuals, we have responsibility, but one of our biggest responsibility is at the ballot box, and it's putting in place the change that will lead to the bigger systemic change. And that is why you have the youth mobilizing in the climate strikes, and that is why you have a Greta going around the world and speaking at the United Nations, because the level of change that we need in the short amount of time that we have to put it in place is going to require for us to think bigger than we've been thinking. Yes, make those changes at the individual level at home, but we need to put in place the system to make the bigger changes.
Great. Now we're going to go into some audience questions. So if any of you have any questions, please make sure to drop it in the comment box. I'm going to start with a question from Patrick Fitzgerald, and he's asking, what about the emissions from your fridge?
The emissions from?
From your fridge.
Emissions from our appliances.
Yeah.
Yeah, I mean, so I think in general, there's definitely appliances that are more efficient, and we should all strive to as we are changing appliances to get those that are more energy efficient. It does make like I said, I think changes at the individual and family unit level make a difference. But we're talking about such a great amount of emissions that we have to make cuts in, that I want us, while we're thinking about the individual actions, to also think about the bigger systemic changes that we want, and that have to happen at the national level, for us to really be able to bring down those emissions.
The next question comes from Laurita Tellado, and she says, we've seen the headlines and news reports on meat plants closing due to COVID-19 outbreaks. How do you anticipate that this crisis will impact our food supply on the long term?
Yeah. I'm not sure about the long-term implications. I think that we are seeing, like I said, that a lot of the way that our economy runs is now becoming apparent to us. A lot of us weren't as aware that our food supply could be disrupted so quickly and in such a dramatic way, right? We thought we were okay for the most part. And we're seeing a lot of food go to waste because it can't be absorbed into the system, because restaurants and many of the places that would bring that food in for consumers are not operating at the same level, right? And then we have the people that are in the front lines of making this food supply chain work, right? And so whether we have to close a processing plant, or whether we have to reduce the hours of workers, or whether people can't be together in groups to make all of this work, all of this has had quite an impact. What I think is that we are going to in terms of emissions as a result of our agriculture and the like, we'll see how much that is impacted in the long run when and if things go back to more of its normal. But what I can tell you is that there are a lot of farmers and policymakers that are sitting at tables and saying, this can't be the way we run things in the future, because we've clearly seen that all of these systems are very vulnerable, and that we can go from feeding an entire nation to hours-long food pickup lines in a matter of weeks, and people going hungry in a matter of weeks. There has to be a lot of rethinking, and I fully expect for there to be fundamental changes made in how we operate, from food supply chains to the way our economies are run. I think we're going to see a lot of changes, and so that may be one of the things that in the future, once we are able to reopen our economy, that we can get to the table in terms of working on to improve in the future.
Yeah, I know that many scientists agree that in our food chain and food supply, there's not necessarily a shortage of the amount, during normal times, of the amount of food that we produce, but more the inefficiencies of how that food is distributed in our system, and our supply chain is not very efficient. So we have another question from Jonathan. How do you feel about the state of Florida opening up? Is this something we should be worried about? And if so, what precautions should we take?
Yeah. Am I worried about the state of Florida opening up? I am worried about the state of Florida if we open up before we have met the guidelines that were issued by the CDC. And so, we have to see a 14-day downward trend in cases, and the same thing in hospitalizations, in order for us to say we're definitely on the downside of the curve and we can start to make those steps. I think they've mapped out the reopening in phases that are well thought out in terms of what things we can do initially, what groups of people should be out there initially. I think if we follow those guidelines, we can start to look at what the initial phases of reopening look like in terms of cases, and whether we should scale that back or continue to a phase 2. I think if we do it right, we may be able to get a handle on it. What worries me is we do not have the testing that we need to scale. We have the capacity to get there, but we are not there. We do not have the number of tests. We do not have the number of facilities doing testing. We do not have enough materials for testing. This isn't just a Florida problem. It is across the country. And I think that until we are able to really get a handle on testing at the level which we need to be, we are always going to be reopening with one hand tied behind our backs. We need to understand who is positive for COVID, who had it and is potentially now immune. We need to understand who has it presently and needs to spend some days in isolation, who that person was in contact with, and that's what we call tracing. And so all of these things are things that we need to have in place in order to open more confidently. This is one of the reasons that here in the county I live in Miami-Dade, we are not going to be reopening like the rest of the state. We still are not on that 14-day downward. We haven't completed that step. And we still feel that, given that we are one of the counties that has the highest number of cases, that we are going to wait a little bit longer to see how that trend goes before we make our decision to step fully into a phase 1.
Yeah, I know that many of us are going stir crazy, and many of us want a haircut, myself included. But if we get sick, that's not going to matter. So if you are able to, please stay home with your family to keep us all safe. Michelle Irizarry is asking, I am concerned about crisis fatigue. Will we really change, or will we move on as if nothing had happened?
Yeah. I think all of us feel a little bit constrained and tired. I think it's normal. I think it's normal to feel crisis fatigue. But I think that, we have to really take advantage of the chance we've had to see the flaws in our system exposed, to see what we can actually accomplish when we all work towards a goal together. I tend to be an optimist with these things, and I tend to think that people do learn quite a bit from these experiences, and that we're going to have changes, and that people are going to have one more variable that they think about as they are considering how they make decisions in the future. As tired as we all are, this has been a lot of time for reflection. Time to consider how we want decisions made, time to evaluate the leaders making those decisions. We've all watched decision-making playing out on our TVs every day. And this is a chance to say, what do I do as a result? How do I confront this crisis and the crises we will have in the future? Who do I want in charge in a future crisis? And how do I want that challenge met by the people that I choose to put in place?
Jose Regalado is asking, how can we encourage science-based decision-making in government? I can't believe we have to talk about this.
I can't believe it either. Well, I think that we have a lot of scientists that are involved in decision-making right now. And we've seen those folks. I think it's really interesting how when Dr. Fauci isn't at one of the briefings, you immediately see people on social media asking, where is he? We want to hear what he thinks about this. And that gives me a lot of hope. I think that science shouldn't be something that's called upon only in times of crisis. I think that fully integrating experts and scientists into our decision-making in times of calm, in times where we're not sort of in a crisis mode, I think is important. So, for example, when you have, even at the local level, when you have commissions, boards, where citizens and experts can participate, we should have those integrated by these experts so that decision-making can happen with a variety of perspectives, including the scientific one. And so that we have these voices already heard and in place. So I have worked for many years on this sort of question of how do you get more science into decision making, many years at the federal level. And now I'm doing it here at the local level. And I think it's a real challenge. There's many competing interests. But I think that as leaders, we have to include these voices, and we have to create the channels of communication and the platforms for this advice and evidence to feed in to the normal stream of decision making every day. And here in Florida, where I live, we have a lot of challenges from climate change that we are feeding in that expert advice, and I hope that that continues in the future and certainly increases.
One of my passions is having a representative democracy, and I think we have too many lawyers and not enough doctors, scientists, nurses, and teachers in our decision-making processes.
I agree.
Elizabeth Rodriguez is asking, what about the 5G radiation?
5G radiation. I'm not sure, Elizabeth, give me more what you mean by that.
She might be referring to the cell towers with the
the cell tower
5G networks that AT&T and other companies are putting out.
I'm not very well versed in terms of what studies have been done for that. And I think I know Elizabeth here in our community. I'm happy to look into it. I don't know what we have what we know so far. But look, I think like everything, like we just talked about, when new technologies are put in place, we should be asking these questions about how this impacts our communities, making sure that we don't just accept decisions being made as taking things for granted. This is we're told, okay, this is the best decision, this is the new way we're going to go. I think that that's part of our responsibility as community leaders, is to ask questions. Is this safe? Does this disrupt any other of our technologies? One thing that concerns me a lot about 5G is, will everybody have access to it? And what happens in communities where they don't have access in the beginning, and who gets access first? So I think there's a lot of questions that we should always be asking from the technology and science perspective out of everything new that's introduced. And it's fair to have experts, again, in those communities, in those committees, in those decision-making processes, to help put the interests of our communities up front.
Marta says, great to hear Alianza is pushing for local expert voices to be moved into decision-making. How do you suggest we do that in a collaborative way around the United States?
Yeah. Well, I am a firm believer in this idea of integrating expert voices, not just at the national level, but in all of our decision making. And I think where it matters most is at the local level, and it's where we have the least of it being incorporated. We sort of think that big decisions that need science and technology information are made at the federal level, and at the local level, decisions are made in a quicker pace, and we don't have time for a lot of this analysis. And I think that's wrong. I think that we have a lot of systems in place at the national level that could be called upon for the local. So I serve on some committees for the National Academies of Science, and I can tell you that there's a lot of talk about how we deploy experts to help at the city, county level. I think that is something that we should ask for a lot more of. A lot of our federal agencies do have experts deployed at the local level. We have regional EPA and NOAA folks deployed. But one thing I would say, Marta, is my dream would be, for example, here in Miami, would be that we could rely on experts from University of Miami, FIU, and other universities and colleges like Miami-Dade College to have a more direct relationship with decision makers at the city and county level. I wish that that were a seamless process where, as decisions are being considered, a team of experts from those higher ed institutions were called upon for advice, that as a emergency operations center is set up for the city or the county, that it is staffed not only with city and county staff and experts or emergency and disasters experts, but also public health experts and statisticians and data scientists and the like. And so if you ask me, I think that that's where the best collaboration could happen to inform our decision makers at the local level would be if we were to get closer in terms of government, academia, and research to inform those decisions and make the best decisions for the people.
Jachi is asking, is there a correlation between high pollution and high level of infections?
So there isn't a correlation between pollution and infections. But what I can tell you is that in places where there has been a high rate or high incidence of air pollution, people tend to already have a long list of pre-existing conditions, respiratory conditions, asthma, and the like. In those places, those people are certainly more vulnerable that if they contract the virus and this results in respiratory symptoms, that they are more vulnerable. And that's when you hear a lot about pre-existing conditions and how those people are more vulnerable, the conditions of the air are part of that. And so in thinking about, and you can really kind of take that and think about it in terms of climate change as well. If you have a place like the Bay here in Miami, where through the years, the Bay's the health of the environment in the Bay has been severely compromised, from the building of the port to waste into the Bay, have really compromised the ecology and the ecosystem of the coral reefs. So you have a Bay that's already kind of weak, right? Kind of sick. Its environment is not as sturdy. And then you have climate change come along and you have warming oceans and the like. Warming oceans, acidic oceans result in bleaching of coral. So you already have a coral system that's weak, so it has a pre-existing condition, and then along comes climate change and exacerbates that, like we talked about before. So kind of thinking, as we talked about the parallels of all these things, it's these flaws in the system, these pre-existing conditions that when the bigger stressor strikes, whether it's the hurricane as a result of climate change or the pandemic, that we are already vulnerable for, and those are the types of things that we need to address, the fundamental flaws and cracks in our system that leave us weaker for when the bigger impact comes.
Oh, your comments and Joshy's question make me think of environmental justice and racial justice. I think we've seen too often how polluters put most of their pollution in marginalized communities and poor communities. And you often see people in these communities with high rates of asthma, lack of food safety, access to food deserts, and many other issues that the COVID-19 pandemic and climate change will definitely worsen. I think I've heard about statistics in some communities that brown and black people are 4 times more likely or have suffered as much as 4 times from COVID-19 because they have many of these pre-existing conditions. And that's a whole conversation about, structural racism and disinvestment in our community. I don't know if you want to add any thoughts to the conversation of racial and environmental justice.
Right. I think you framed it well. I think what we've seen in a lot of places around the country is that these communities have been impacted in a disproportionate manner. Not everywhere, but certainly in some cities, we've seen that. And it goes to the problems that were there before, but have become sort of front and center. Whether it's access to healthcare, preventative care in these communities is not as accessible as it is for other communities. Whether it's food availability, like you said, food deserts. And that's something that a stressor like the pandemic or climate change really sort of make worse. And, when we look at communities here in the South Florida area, one of the things when we know that hurricane season is coming, one of the first things we think about is how will a family in a frontline community that lives paycheck to paycheck be able to go out and prepare in advance of a hurricane? Most families don't have the means to buy 2 weeks worth of groceries to stay inside and protect themselves, right? And so all of these things are part of the flaws in our system, and the way that, like we talked about before, food supply chain, the inequalities that have become more evident right now, how we need to work on those to make us stronger, to make our communities more resilient.
Well, I think this has been a wonderful discussion. I want to thank so much our audience for tuning in, for asking very thoughtful questions. I think they thoroughly enjoyed having you here, Dr. Colon. So thank you so much for being awesome, for being here, for sharing resources and information with our community. And, we want to remind you all to make sure to fill out your census. It's important for our communities to be counted. This is how money for our schools, for our hospitals, for our communities is decided. Please make sure to sign up to vote by mail to keep you and your family safe. It's easy. Most localities are paying for postage to send it back. And please, look at Alianza. We have some petitions to change the name of the middle school to Roberto Clemente. And if you want to volunteer and if you want to help our community and conduct calls to make sure that our vulnerables are doing well and to see how we can help them, please drop a comment or email us or message us. Thank you so much, Dr. Cullen, and thank you everyone for tuning in.
Thank you to the Alianza team, and thank you folks for listening in today in this conversation. It was a pleasure.
Bye, folks.
Bye.
Bye, Dr. Cullen.